Welcome to Beyond the Needle, the Aesthetics Business Podcast. I'm your host, Emily Ruse. I'm a former clinic manager turned digital marketing freelancer, and I've had the privilege of helping dozens of aesthetic practitioners across the UK and beyond grow their business. So I know firsthand just how challenging it can be to build a successful aesthetics practice in today's competitive market. Each week, I'm here to share real, actionable strategies and bring on expert guests to help you level up, attract more patients, and build a standout brand. Let's turn your passion into a thriving business together. Welcome back to another episode of Beyond the Needle, and today I'm delighted to be joined by Dr. Amy, a highly skilled aesthetic doctor and clinic owner, known for her expertise in skincare, full face rejuvenation and patient education. Amy has built a thriving aesthetics business, but her journey hasn't always been without its challenges. From transitioning from dentistry to aesthetics to navigating the business world and avoiding costly mistakes, she has learned a lot along the way, and she's here to share it all with us today. One of the things that sets Amy apart is her ethical approach to skincare sales. We all know that retailing skincare can feel pushy or sales driven, but Amy has completely changed her approach, making it feel natural, educational, and genuinely beneficial for her patients. She'll be sharing the exact strategy she's used to increase skincare sales without ever feeling like she's selling. And of course, we have to talk about her viral Colleen Rooney transformation. While Colleen was braving the jungle, her skin remained flawless thanks to a medical grade skincare routine designed by Amy. We'll be breaking down the secrets behind those results and how practitioners can leverage real case studies to grow their businesses. In this episode, we're covering Amy's journey from dentistry to aesthetics and the lessons she's learned along the way, how to sell skincare ethically without ever feeling pushy or transactional, the skincare strategies she's used in her clinic to build trust and increase patient conversion, her viral Colleen Rooney transformation and the power of social proof in aesthetics, business growth strategies, what's been worth the investment and what hasn't, and why staying small can be the key to long-term success in aesthetics. If you're an aesthetic practitioner looking for practical advice on growing your business, selling skincare with confidence, and avoiding common mistakes, this episode is packed with value you won't want to miss. Hi Amy, thank you so much for joining me this morning.
Hi Emily, thanks for having me.
No, thank you so much for coming on. It's a pleasure to have you here. So Amy, you originally trained as a dentist before later moving into aesthetics. What was it that drew you into aesthetics, and was there a moment when you knew that it was the right path for you? Tell me a little bit about your background and how you got to where you are today.
So I fell into aesthetics purely by chance. When I qualified back in 2016, aesthetics wasn't really a known career pathway that dentists, or I didn't even realise you could get into the pathway of aesthetics. It was only a few people when Instagram started getting a little bit bigger, you saw more people, especially medics, doing aesthetics, and people were advertising more of the courses. I just fell into it by chance. My friend said to me, look, there's a Botox course in London. Do you want to come? We had like a couple of days off, and I thought, do you know what? If anything, I'll be able to do it. We'll be able to do it on each other, if anything. So I went down. Really, I mean, the training was very different back then to how the training's structured now, but I really enjoyed the difference that it can make. I mean, for someone, so like I said, I think for a lot of people out there who've had the treatments, I think everyone could agree when you've had them, you really realise the difference in your confidence. And I thought, God, could you make a career out of this? And I used to work as a dentist, and I loved chatting to people. I can chat to anyone. But working in NHS and dentistry is really hard. There's a lot of targets to hit, especially when COVID hit. That was what really pushed me into thinking I need to make a decision now on, do I kind of push doing more aesthetics, or do I push going down more into probably less NHS dentistry? And my enjoyment was just that it was starting to pick up my clinics in Manchester. And I was like, do you know what? If I don't take the leap now, I probably won't do it. So I took the leap, and that's where actually there was an opportunity to join Skin Viva as a trainer and clinician there. And I went from doing probably aesthetics, 3 times a month, to then suddenly doing it like 3 times a week. So it was a massive career shift and an educational point of view for me as well, learning from a very big, wide-scale number of patients. So that's kind of what shifted me. And then obviously from then it just progressed to kind of figuring out what I wanted to do for myself and do things my own way.
Amazing. And what skills from dentistry do you feel have been most valuable in your aesthetics practice?
I'd probably say, I mean, Hands-on skills, I think I think manual dexterity has always been obviously an important skill to have doing any kind of aesthetics. And I think being a dentist, I've really been able to hone in on my manual dexterity, obviously working in kind of small spaces in the mouth. I'm very, very gentle. And I think I'm very perspective on obviously patient's awareness of discomfort because I'm used to dealing with injections in the mouth and making sure they're comfortable. But to be honest, it's probably the communication because I mean, dentists are known for small talk. Like we are pros at small talk. So I think having that experience, even with the NHS, it's a lot more quick paced. It's you still got to make people feel at ease. You've got to see a lot of people. You've got to make the same conversations. And you can get a real good diagnosis. I think from a dentistry background, we're very, very good with making sure we get a thorough diagnosis and documentation of notes, which I think really helps just from a medical legal point of view as well, doing anything aesthetics.
Yeah, no, that makes total sense. And when we spoke before recording today, one of the things that you mentioned to me was the challenges that you had when you first kind of started your business. It hasn't always been smooth sailing. What were some of the biggest challenges that you faced early on?
Oh God. I mean, when I started doing aesthetics properly in like 2017, there was no WhatsApp groups, there was no Facebook groups. Everyone was very much like, if you asked anyone for advice, they were like, well, I'm not telling you because why would I tell you? You're my competition. And it was really hard because you felt like you just needed someone to give you a bit of honest feedback or a little bit of guidance. And it felt like there wasn't that. I think it's changed drastically. I mean, you're still going to get that. But I think there's so much help available now in terms of the internet, WhatsApp groups, Facebook groups. You can, I think I'll start how many WhatsApp groups I'm in now, but if you've got a question or anything, you've got access to hundreds of people who are willing to just share their knowledge and information and actually give you that information out there as well. I think always as well, I think the struggle is as well when I mean, like I said before, training's improved massively since I started. But I think it was always hard deciding on what training to know to go on. And it's hard when you start out because your finances are really kind of limited. So it's trying to figure out what's going to give you best value for money, but also improve your confidence and make sure that you're not then after going to spend more money on courses when you've not really gained the confidence that you had from the course.
Yeah, I think the industry's definitely improved over recent years in terms of the communities that you can find with other practitioners. And I think it's so important as well for when you're first starting out, and especially when you're a sole practitioner and you're working on your own and you go from working in somewhere like a dentist or in the NHS and you have colleagues around you you can go to and ask for advice, and suddenly you're working on your own in this clinic. And, if a patient comes to you, and maybe they've got a complication, it's just nice to have people that you can go to for advice so you don't feel completely on your own. So I think it's really nice how the communities in aesthetics have developed over recent years and how there is so many WhatsApp groups and so many supportive communities like the Nurses Network, for example, and places like that people can go to. And one of the things you mentioned to me as well was that you actually got scammed out of your website quite early on. Can you share a little bit about what happened and what you learned from that experience?
Oh yeah, God. I think, you get a bit of PTSD when you think about things. I mean, you'll always talk to everyone and they've probably felt like they've lost a lot of money on certain things. And one of the things I quite soon wanted to invest in was like a website. I put it off for years because everyone said, I kept thinking, and people, you'd speak to different people. Some people said you needed it, other people said you didn't. And to be honest, you 100% do need a website. I think it validates you, and I think people can go there and just really research you. So I went to the conferences, and obviously I was looking at the companies that, were at these conferences and really advertising themselves. And I went on a few websites that I thought looked pretty and I liked how they looked. And obviously I know now a website can look great, but not function great. So I went on and I didn't ask for any recommendations. I just went on a company who'd done a few websites I like the look of. And they seemed great. They really sold the dream. And I kind of was quoted. I mean, I remember in lockdown listening to a webinar about people talking about websites and saying, look, you're probably going to be spending about 4 grand, 5 grand. And to me, that was like, whoa, I could not afford that. It was completely out of my league to even think of dreaming of spending that much. And I finally got to a point where I could say, do you know what? I could spend that amount of money if it's going to give me what I want from a website. And I ended up going with a company and we did a filming day and I kind of had a rough estimate of a quote. And so I kind of knew it would probably be about 4 or 5 grand, but we're doing a content day. So I knew it was going to probably go to about 6 grand-ish. And anyway, as it took 12 months to get this website made. And I honestly, I mean, I know from a lot of it is my part, so I have to give them information, tell them I want it. So the first draft of the website, I looked at it, thought, oh my God, this looks terrible. So I was like, but it's fine. I've got to give them input. And, I was spending ages going through, like, can you change this? Can you change that? To get a change, I used to have to badge them for 3 months, even if it was a word change. And it got to the point where I was at my tethers and I was like, this website is never going to get made. And it was just heart destroying because I was really hoping to, like, obviously speed up my growth, and I needed the website to do that so I could get on things like the SEO and everything. And in the end, when it finally got done, and I was asking for a couple of extra things, and I got billed, and let's just say the bill was at least over double what I anticipated, and I was shocked by it because I was like, I in the initial quote, and I would have hoped there would have been an update. Like, when you ask for things, they say, well, this is going to cost this
Yeah.
extra. So, because I had no clue. I was like, can you add an extra word here?
Yeah.
Can you add this bit in? And anyway, the website itself looked very pretty. And I was like, brilliant. But I'd lost confidence in that company. So I went and asked for advice this time, like, who can I choose to help run the website and actually do things at the SEO side? And then I was shocked when I had two separate companies look at my website and just tell me how bad it had been developed. So it was, if you have a traffic light system of green, amber, red, in terms of how well it will rank on Google with SEO, I was basically in the amber and red for everything. The only good thing is they hadn't locked me in, so someone else would take over the website. But when you're spending nearly 12 grand on a website, you do not expect it to perform so bad. And I just thought, God, in the end, I had to just wipe the slate clean and think, do you know what? I'm just going to trust someone to take it over. And thankfully, they've took it over. It's been completely redone. Well, as in, it looks similar. If people were looking at it from the outside, it would look very similar. But the way it's running now, it's all in the green, and it functions really well. I found really good people from recommendation. But it's the one thing I would advise anyone starting out with anything, because your costs only go up when you want to grow. Go off recommendation 100%, whether it's social media, whether it's websites, whether it's someone to do your SEO, your Google ads, anything and anyone you want to use, go off recommendation, because there's a lot of big companies, unfortunately, that promise the dream, take on too many people maybe, and they just don't deliver. And that was just my experience. I'm sure other people may not have had that, but I've had a few people, not from the same company, but I've heard of other companies who with similar things. So that's the one thing I think that's probably scarred me the most in my career in aesthetics.
Yeah, soul destroying. 12 months, I mean, is just crazy because you would have expected at that point for the website to have been performing for you, bringing in new clients.
Oh, I know.
Yeah, it really is. And it's great advice as well about finding someone through recommendations. And I actually find this a lot as well. People, they think, it's very easy to create a pretty looking website, but it's something else to make sure that that website's actually going to rank on Google for the keywords that you want to be ranking for, so that people can actually find you and will see the website. I mean, that's probably the most important thing. So, and I think that's a mistake a lot of practitioners make because they don't realise, and then companies can take advantage of that. So I'm glad you've got it sorted now. But I was going to ask you what advice you would give to practitioners who are just starting out to avoid making those costly mistakes. But I guess you've kind of hit the nail on the head there with the recommendations.
I think the problem is that when you're starting off, I mean, I completely get it, because I remember being at a point where I can still remember just having a patient walking through the door was like a win for me. You don't have the expendable income to spend a lot on social media and websites, etc. But what I'd probably say to someone is save your money until you can afford someone who will do a good job. I remember back in the very first era of even social media managers, like you could pay, and I was paying, like, top package at the time was like $250 a month, which now you would never find anyone for $250 a month. And they weren't really doing a lot of aesthetics. They were doing aesthetics with more beauticians. And again, you need to find someone that you like their work, you've had a recommendation, and just, if you can't afford them at the time, save up till you can, because there's no point having a subpar job, you getting frustrated by it. You may as well, like I said, do what you can yourself. And then, like I said, you're in then a better position for when you can take someone on to help you with some form of marketing. I wish I'd done a website and got onto SEO sooner. I did not realize the amount of people that you can reach through Google. I was like, Instagram's everything. That's all you need. And no, God, so many people are on the internet.
Yeah. It's still, I say to people, the top 3 areas that should be bringing in the most traffic for you, or the most leads and inquiries for you, should be, like, for most people, it's Google's number 1 still, then it's referrals, and sometimes it's the other way around, and then your social media. But Google's still huge. That's where people are searching for people, Botox near me, fillers near me, reading through the reviews of the clinics that come up in the top 3, on the Google Map section that will come up at the top of Google. That's where a lot of people are still finding
Do you know what?
clinics.
When I was getting my breakdown on SEO of what the most searched terms are in Liverpool, I actually ended up training in sculpture because I didn't train in it because I was unsure. I was like, in an hour, do I do a train in it? And then it came to the top 3 of search terms in Liverpool. I thought, oh my God,
Wow.
I'm missing out on this. And do you know what? I've never looked back. I trained in it, and the amount of people coming in asking for it, I've heard about it. So, like I said, if you can get someone in to just do some little bit of market research of what's in the local area, it's very
Yeah.
different because I'm in a very competitive area in Liverpool. So I hear some people where they solely get just word of mouth. For me, I'd probably say at least now 60% comes off Google for new people
Mm.
whenever I ask them. So it works phenomenally well.
Yeah, it is so, so, so important. I wish more people knew that. And even if you just get someone in to do like an audit of your website and clean up, on the back end, because, like I say, it's all well and good getting someone in to create you a pretty website, but if that's not optimized on the back end, people won't be seeing it. So even, I think people think SEO has to cost the world. It doesn't, and it doesn't have to be a monthly retainer either. Even just getting someone in to do one-off clean up on your website can make a massive difference to how you're ranking. And another thing you're quite passionate about is skincare. And, skincare sales can often feel uncomfortable, I think, for practitioners, and patients, I think, often have their guard up with skincare. How have you refined your approach to make selling feel authentic and educational rather than sales driven?
So I think for me, I remember when I was not doing any skin really, I wasn't doing any skincare sales, and I got a business coach, and I said to myself, right, my one target is the cost of my business coach per month I want to make back in skincare. So it was a driver for me to actually just get my
Mm.
ass into motion and actually talk about skin. And it can be really, like I said, it can make people feel uncomfortable talking about skin because people are coming in for one thing. They might have a wrinkle, or they might come in because they've got, a bit of volume loss. And then you want to broach the topic about skincare, and it can feel a little bit awkward. So what I try and do is the way I try and shift that barrier is in all of my medical history forms, I have a skin health questionnaire. So the skin health questionnaire will go through, do you suffer with things like redness, age spots, uneven texture, oily skin, dry skin, all the layman terms of how someone who isn't medically qualified would understand seeing what their condition is on their skin. Because if you start saying things like rosacea, no, people may not have heard of rosacea and don't understand it. But if you say redness or fluctuating redness, they might be like, oh yes, tick. Hyperpigmentation, people may not understand that. Call it age spots or dark spots on the skin, and they actually understand that a little bit more. Fine lines and wrinkles. So when they tick that with the consultation, I always look through and see if they've ticked anything. And I always say on the skin health questionnaire, if there was one thing that you can improve in your skin, what would it be? And then, some people might say nothing, which is fine. Other people, it might be like the texture, the pigmentation, the acne, the oil. So what I'll do is in the consultation, whatever they've come in for, I'll also say, oh, look, by the way, on your skin questionnaire, I see that you've mentioned about suffering from X, Y, Z. Is it okay if I talk to you a little bit about how I can help you with that? And so you ask permission, and I never get anyone saying no. And depending on the time of obviously consultations, one of the things I've probably realized is my consultations, I book 30 minutes. And to talk about skin, it's a long time. And if you overwhelm them a bit too much with what they've come in for and then their skin, it's a little bit overwhelming. So what I tend to do is I offer everyone that comes in a complimentary skin health review. So I just book them in. It's a short 30 minutes. We put them under the skin scanner, the Observe, and we go through what they're using, educate them about what's going on under their skin, what products they're using, how it's impacting their skin. And then I go through recommendations. And to be honest, you rarely ever do not get anyone who's gone through that and is committed to saying, yes, I want to learn about my skin, who doesn't then walk away with a better understanding and actually improving on their products as well. Especially the skin scan has been one of the best things I think I've brought for that because it revalidates what you say.
Yeah.
Because like you said, you can show someone, okay, you've got enlarged pores, you've got oil, you put them on the skin scanner and they see the congestion and they're like, oh, or the bacteria or pigmentation. People are like, oh my God. I mean, it does make things look a lot more dramatic because it's more all the other kind of settings of erase any other kind of redness and stuff, but it really highlights the severity of any underlying conditions. And from that as well, they massively upsell skincare. So I don't really get anyone that doesn't buy anything. And it's not a hard push that way because I've literally just said to them, I'm not here to do a hard sell. I just want to see how happy you are. And one of the good tips I always give, like if anyone comes in and I say, they might be on their Charlotte Tilbury, they might be on their, Elemis, and they're like, oh yeah, but I've been on these for years. I'm like, okay, right. So how happy are you with your skin on a scale of 1 to 10? And often they're like, well, a 5. And I'm like, okay, and you've been using these products, what, 5 years? And you're in your 5 out of 10? And it clicks with them then because some people are like, oh, I've been using these products for years and they're my ride or die. But I'm like, why aren't you a 10 out of 10 with your skin then? So and that way it's not me being a hard sell. I'm just stating the obvious.
Yeah, I love that, and I think that's why the skin scanner can be so powerful, like you say, because it doesn't feel like a hard sell. Then you're showing people what's actually going on with their skin, so they can see it with their own eyes, and then it just seems like a no-brainer that they would want to, invest in the products that's going to help overcome those issues before they become a real problem and come to the surface. And I guess also you can show people how their skincare is actually changing their skin over time
Yeah.
through the skin scanner, and then they know it's working and they're going to stick to that regime. And is it true that you also encourage new patients to bring their existing products in with them so you can have a look
Yeah.
at them together?
So I always say, bring in all your products because I want to see what you're using. And because some people might be using, products that I think generally aren't too bad, and depending on budget. So another thing that I always am very passionate about is I always ask people, look, what is your budget? What can you spend monthly on skincare? Because if their budget is a bit smaller, I'm not going to say to them, throw away all your skincare and switch completely to medical. I tend to substitute products out. So I'll give them more low cost, high street recommendations, like just like your normal, like kind of CeraVe hydrating cleanser. If the cleansers, because the cleanser's probably not going to be all and end all, but I want them using something that isn't going to be stripping away any too much oil from their skin, be too harsh. But some of the products they might use, and I think, do you know what? These actually aren't bad.
Yeah.
Keep using them. When you run out, let's substitute to another medical grade skincare.
Yeah, no, that makes total sense. And I also wanted to ask you a little bit about your amazing transformation with Colleen Rooney recently that went viral. And that was obviously very much to do with her skin. So, what were Colleen's key skin concerns and how did you develop a plan that delivered such amazing results?
So she came to me about, it must be about almost two years ago now. And her skin, like she was using just expensive high street skincare. So she had quite combination skin, like it was very oily in her T-zone. She'd been on holiday and probably wasn't wearing enough SPF. So she did have some melasma, which is, increased pigmentation, often hormonal. She also had some sun damage on her skin as well. And she just wanted my advice on what could be done. And I said to her, look, and I say this to anyone that comes in, when it comes to pigmentation, without a doubt, you kind of absolute Rolls Royce of all skincare systems is going to be the Abargine Nuderm. It is prescriptive, but it completely transforms your skin. So it's the only product, it's like the gold standard in the market to suppress the pigmentation production with hydroquinone. But it has everything to help shed off the old skin, bring in new skin, healthier, more hydrated skin. And it's the journey though, because like you said, she wasn't used to using so many products and we'd get her back in. So I always tend to review people kind of 6, 8 weeks, 12 weeks, and we'd have to adjust the protocol and also give her some prescriptive tretinoin, which is going to speed up the turnover of new skin and shed that pigment out quicker. So we went on a journey of really kind of working on like a lower strength products to higher strength products to really kind of get rid of as much pigmentation as possible. And I think I mean, I was blown away at the difference because even when I remember seeing her in the jungle and everyone was commenting on how good her skin looked, and I thought to myself, I was like, you know what? Her skin looks amazing. She's come so far compared to when we very first saw her. Where like her skin wasn't bad. She didn't have acne, or to the layperson, it probably wouldn't look that bad, but it was just a bit dull. It wasn't as useful. It was more uneven skin tone. So just by changing a few things, it's transformed her skin, and she's kept on it really well. She's probably like one of the strictest people I know now with her skincare. So she does it to the T.
Wow. Yeah, it just goes to show how powerful the right skincare can be and what a difference it can make. Like you say, that it wasn't like her skin was bad before, but it looks so much healthier now. And yeah, she's just radiant, which I think is just the goal of most people when it comes to their skin, isn't it? Can you tell us a little bit about how Colleen came about? Was it through something you were doing with PR, or did she find you through word of mouth or through Google?
So it was actually word of mouth. So there was a dentist in Liverpool who she sees for her teeth who recommended me. Which was really nice. Which I was surprised. Obviously, I know she's from Liverpool. She's a Scouser at heart, but she doesn't live in Liverpool now. So for her to come this way to see me and keep seeing me, it's an honour really, because she's such a lovely person. So, and it also word of mouth, I think, is the greatest honour when someone recommends you
Yeah.
to someone.
Yeah, no, absolutely. And what have you kind of learnt from your experience where the kind of photos went viral? Did you get a lot of inquiries off the back of that?
I mean, I must admit it kind of blew up because obviously I mean, for me, and I always tell people this, I'm always quite cheeky in the sense of I'll always ask people if I can use photos if they've had a really good result. And I've never posted anything with Colleen because I've always made sure I respect her
Mm,
privacy. And it was when she came out of the jungle, I just sent her a message and I said, Colleen, look, you've had such a great result with your skincare. Everyone is mentioning about it. Do you mind me sharing your photos? And she was like, no, that's fine. So I couldn't believe, I think for 2 weeks, my Instagram, I've never known so many notifications be popping off. And don't get me wrong, I wouldn't say by doing that, I've had loads and loads more influx of
mm,
people coming in for the new derm. Ironically, the new derms get out of stock though for the first time that I can ever recall. But I've had on the back of it people being aware of the skin, and I think people seeing that I've done Colleen's has brought them onto my Instagram and seen that I do other things. So I wouldn't say on the back of it. I guess I have had quite a few people come in to talk about their skin, but actually I've had more people who from the back of it have obviously then looked on my Instagram, looked on my website, and then found me and actually came for
mm,
other things. Because don't get me wrong, a lot of other practitioners will also prescribe
yeah.
the Abarginudum, and a lot of people will share in their posts, which I'm all for it because I think I love the brand. I think I love the products, but from the back of it, it's more giving people that my exposure for what I can do for people. That's probably what I've seen the biggest
Yeah.
impact with.
Yeah, like you say, people can go to kind of anyone local to them who sells a bargee, and I guess it's really pushed the idea of good skincare for people and what that can actually do and the difference that can actually make compared to over the counter skincare. And obviously, you said a bargee is kind of the gold standard for treating pigmentation. For practitioners considering introducing clinically backed skincare into their clinic, where should they start? What other brands do you enjoy working with?
So I like to keep things really simple. I think the problem with working with lots of different brands of skincare, it can get very confusing
Yeah,
because you learn about all the different protocols and they can conflict each other.
yeah.
So for me, I personally prefer to stick to one brand I know through the back of my hands and heart knows works. I know how the protocols are for the products. And obviously, the thing is, what I would say with a Bardi is, which I completely appreciate, it isn't the cheapest, but it is probably on par with more your high street cosmeceutical skincare. I did look at trying to bring in probably slightly cheaper brands for certain products, but then in the end, it wasn't going to work out that much cheaper, and I just couldn't believe in the products because I know how Bardi is, I know how it works.
Yeah.
So for me, the only downside I would say with a Bardi is you can buy the products. The non-prescriptive products can be bought online. Now, this doesn't mean that they're legit. They
Mm.
should only be bought through the authorized providers, but people won't know that, and people can still buy them online. I think what I would say is if you're starting off, go with a company that will give you very, very good training. I mean, the reps from Abardi are fantastic. Like when I very first started, and like you said, your knowledge isn't there yet because it comes with experience. I would message the reps. I mean, Faith, who is of Manchester, way bless her, she must have helped me so much when I was first starting out because they are very, very, very supportive. You message them on WhatsApp, you get a reply that day. I don't know what it's like with the reps from different companies. What I'd probably say is just go for a medical branded company. So you've got your Abardi, you've got your Zedo, you've got your Illumia. Where I think Abardi stands out is the prescriptive items. I'm pretty sure with Zedo, you can't get a lot of the prescriptive items in the UK. Things like your tretinoin, you can only really get with Abardi, and it is just phenomenal. So I think you could probably go for if you wanted to go for slightly cheaper products, you might be a little bit more limited. And I must say that with Abardi, the products and the support and the training is phenomenal. You will lose out a little bit with patients going online, but what I tend to do to mitigate against that now is for regular customers, I give them a discount and they have an online shop and I get them back more frequently. So if they're coming back more frequently before they've run out, I can see them to kind of get them back to selling the skincare before they go online. So that's one way you can kind of try and mitigate against that as well.
Yeah, no, absolutely. That's brilliant advice. And going back to kind of the start of your business, what would you say has helped get you to where you are today in terms of how you've marketed yourself and how you've put yourself out there?
I think the two biggest things I can probably think of is I've put myself on camera a lot, and I mean I cringe at some of the things I did like a couple of years ago when I used to do these crazy dances that I thought would be popular. And do you know what? I was only doing it because it was trending everywhere, and I don't think my patients actually cared if I was
We've all
dancing.
been there. We've all been
I
there.
think putting yourself out there is really important. I know it's something that people always hate the most, but I think people generally buy through people. And if someone can feel like they've met you and seen you talk and see how you are with people before they come see you, it massively puts them at ease.
Yeah.
And like I said, if there's a choice between you and someone that they don't have a face, then they're going to go for the person that they see and that has a face. The other thing as well is I'm a bit of a risk taker, so I will heavily invest in things like marketing. I mean, my spend on marketing has increased over the years as I've grown and got things more like your website, your SEO, and I've recently gone into we're using a company that will then do also Facebook ads, which have actually been phenomenal. I did not think they would work as well as they have, but investing in yourself in marketing, I always think you've got to spend money to accumulate money. And I think a lot of people, if they're not a risk taker, they will always be held back that little bit
Yeah.
and I completely get it. I don't have children. I don't, I have a mortgage to pay, but that is basically it. So I don't have anyone really depending on me. So I can take more risks, but I've always been a bit of a risk taker anyway. So by spending more on marketing, it is a risk because you don't know if you're going to get the return and reward. Similar with getting someone for social media or doing someone for you like Google, you don't know if it's going to actually work. I recently started doing Facebook ads with a company and I was thinking to myself, oh, I don't know if this is going to work. I just didn't, they kept saying your demographic is on Facebook. And I was like, well, I know that, but I don't know. And God, have I been proven wrong? Again, this is another thing I say to people like, you've got to, don't knock things till you try it. And I was on the edge of being like, let's not do it because I wasn't seeing anything. And it took a month. And then since then,
Yeah.
the amount of people through Facebook, and I don't use Facebook really. I mean, I use Instagram, and it just shows if you get the right company that know how to do it and market well, you can really get, again, another market of people another target market that's going to be more visible to your clinic.
Yeah, that's amazing. I think Facebook ads, I often hear from people they've either had a really good experience or really bad experience, but I do know it can take a little bit of time to kind of build them and to get those consistent leads and inquiries coming through, because obviously like there's a lot going on when you set up an ad, and the algorithm has to learn about the audience and who's responding and then show it to more of those people. Can you tell me a little bit more about the ads? Because I feel like this is an area that a lot of people will have questions about. So is it just Facebook that the ads are on, or is it Facebook and Instagram?
So it's just Facebook. I'm pretty sure it's just Facebook. It might come through on Instagram as well. So I have seen my ads when I'm on my personal account come through on
Yeah.
Instagram. So I think they're synced. So I think my Instagram and Facebook are synced. So they'll come through on both. But the biggest difference is it's very different. A Facebook ad is very different to boosting a post on Instagram. I think I've learned recently there's no point boosting a post on Instagram really, unless it's a post like I'll boost the clean Rooney one because I knew that one was going to get a lot of traction. I've spent hundreds on boosting posts before and it gets me nothing. So Facebook ads, it's a very complex system whereby you need someone who's going to monitor it daily to see how much that lead is costing. So we trialed different ones. We did because you can't advertise before and after photos, but you can do almost a bit of catch bait. So you can put a before and after and kind of blur the after. So it kind of entices them to kind of click on it. But you can do a mixture of videos, statics, before and after, but not a before and after like blurring it. So what we trialed was we did we did obviously some talking about clean skin of one of them. We did a video of me talking to a pain point. So a pain point is like, do you look at yourself in the mirror and feel like you don't recognize yourself anymore? And I'll overlay that with videos of me treating, consulting. So again, keeping it to 45 seconds. And what we found was some of the posts were costing £17 a lead. And I was only putting my budget as £20 a day. So we were like, we need to remove that. And the company does all this. So they would automatically say, that's not working. Let's take that off. If we can get it down to a post to spend about £4, basically it's quite cost effective. And you will get a lot of people coming in, and it has to learn. So the first month was a lot of learning, because people clicking on it and getting a message that I don't know what I've clicked on. So I had to explain to them, right, this is what we need. They need to know exactly what I do. So they click on it. We entice them in with a free consultation, which actually went against the complete grain of everything I've been told. I was like, I don't want to give a free consultation. But actually, it worked really well, because what we did is they still have to pay the consult fee, but that will get refunded if they don't go ahead for treatment. And actually, apart from maybe 3 people I've refunded because they just were not suitable for treatment, every single person that's come in through Facebook has been the absolute perfect target bracket of people I wanted to target for age, demographic. It has worked far better than anything else I've ever done with Google. Google still brings in a great number of people, but Facebook has actually been very well targeted, because you can do things like, and it's a minefield, and I'm not an expert in this, I will probably be saying this wrong. There's things like funnels, where if someone has seen you on Facebook and they have clicked on your link, or they've looked at your video for a bit, that person's then targeted. So then all the other ads start getting pushed to that person. So there's like that rule of 7 points of contact, isn't there? When someone has seen you 7 times, and someone came up to me like, you just kept popping up. And I was like, did I? I was like, that means it's working.
It's so true though. It's like, people get freaked out because they'll go on a website, or they'll, look at something on the internet, and then they'll go on Facebook and they'll just see ads everywhere for it. And that's why Facebook ads, I think, are so powerful, especially when you get the actual ad asset right and the audience that you're targeting right. Those are the key things. And I think people think Facebook ads is quite easy,
Gosh,
and people try and do it themselves, and that can very quickly go very wrong, because it's a very, very intricate thing that requires a real expert knowledge, and there's a lot of elements to it. And yeah, I completely agree with boosting posts. I say to my, because I get clients that ask me, can we boost posts? And, it's just not worth it. It's really the only way that it's worth it is if, like you say, you've got a particular post that's doing very well organically, and therefore you just want more people to see it, like that clean Bruni transformation makes perfect sense to boost, because, but you're not relying on it to bring lots of leads and inquiries through, because obviously when you've got ads, you can have your lead forms, you can retarget people. It's just, a whole different ball game. So yeah, I completely agree with you. Do not waste your money on boosting posts if you want them to be bringing you more leads and inquiries. It's just not the way to do it. But no, I love that. And what have you found? So obviously you say you've got a couple of different ads set up. So you've got a 45-second video. What kind of video is that? Is that you speaking to camera about a specific?
Yes, so we've done some targeted ones. So we basically have done ones for my main focus points were kind of targeting people who want that kind of full holistic rejuvenation, but obviously knowing that people are wanting natural results. So I'm targeting probably it's 40 plus. So I'm talking to people and saying, look, do you look at yourself and don't recognize yourself in the mirror? Do you feel how you feel on the inside doesn't match how you feel on the outside? Then I'll kind of talk about, well, look, my name is Dr. Amy, I've treated XYZ. These are common complaints we get in clinic all the time. You're not alone. This is how I can help. For the months of like March and April, we're offering free consultations. If you would like to book in, please click the link below. And then I've done one for like non-surgical rhinoplasties, because I do a lot of that as well. So, but again, it's talking in layman. So it's like, do you avoid photos because of the profile? Do you feel that the bump in your nose is really, really interfering with your confidence and self-esteem? Instead of just saying, come in for a non-surgical rhinoplasty, people are just like, I don't know what that is. And you've only got a few seconds, haven't you, to grab their attention?
Yeah, absolutely. But speaking to those pain points can be so, so powerful, and it just hooks them in instantly, doesn't it? And so a lot of practitioners kind of rush to expand, but you've said previously, stay as small as you can for as long as you can. Can you explain why?
Yes. So I think it's very easy to get sucked in with the excitement of obviously expanding, hiring staff, taking on new devices. All of these cost a lot of money. And I remember someone saying to me, like, you can be, asset rich but cash poor. And like you said, if you have all these staff members, you have all these devices, you are literally working to pay their bills, and pay their wages. And then what you take home at the end of the day is very minimal. And the whole point, I think, of working is you go to work to enjoy it, but also so you can have the balance of a work-life balance and enjoy the things in life. And I think there's nothing, I think it's quite humbling when you hear people who will happily admit that they don't want it. Because I think there's a lot of pressure, isn't there? When you see a lot of people on social media, they have the big clinics, they have all the devices, they're absolutely looking like it's smashing in life. Then you hear the other side that kind of smokes and mirrors, where down the grapevine you hear that, oh crap, they're in loads of debt because they're having to pay off all these machines. They're having to work 7 days a week. The stress levels, they can't go on holiday because they don't have the time because they've got to pay all the staff wages. And I just think if you hone in on something that, again, the good thing about aesthetics is you don't have to spend a lot of money to be good at your trade. You know, your dispensables, like your fillers, your Botox, your, biostimulators, they don't have to cost you anything. You're only buying them in, obviously, as stock. When you get into starting to pay for things like devices, you have to be aware that you are paying them off then, and you've got the added pressure of having to market them and make sure people are coming in to use them to pay off what you're paying for the devices. So for me, when I'm buying anything, like last year, I got a couple of new devices because I felt like they would fit in well with the expansion of my portfolio of treatments, because I feel like I'd mastered marketing all my other treatments. And there was definitely a demand for, because skin is obviously, good skin is in now and everyone wants more skin tightening. I said, if I didn't get something that's going to help with the skin tightening, I will be falling behind in what kind of trends are going ahead. And I think in terms of giving people that holistic package, I wanted something that wasn't filler or sometimes wasn't Botox, because some people don't want injectables. So I got two devices. I got them from 3D Aesthetics, and they weren't that expensive compared to what you can pay for the top end brands. But the technologies are the same and they work brilliantly and they haven't broke the bank. And I'm expanding to get a skin therapist in now, because it's got to the point where I do need someone to take over the skin side and someone I can mentor and be like a mini me, because then I can focus more on the injectables. So I've got time for patients booking in for that. But I'm not really rushing to get crazy. Like things like everyone says to me, would you not got laser devices and like CO2 lasers and all of that? I mean, they cost thousands and thousands. And in all honesty, I like my life. And I also think my therapist will be busy enough doing the bread and butter treatments. And I really like, I spend so much on marketing for myself to grow. I would have to spend so much more to market for them. And it's just not for me at the moment. I mean, who knows? I might eventually go down that route, but I also enjoy having a life and enjoy my work-life balance, which to be fair at the moment does seem it's a bit stretched, but if it would only be more stretched if I had the pressure of all the extra devices that I would have to pay off. And a big clinic, my clinic, it's a very modest, it's people have gone to my clinic. It's one large room and then a little waiting room. I don't have this own sole clinic that's just mine, that I've got to pay a massive mortgage on, loads of bills. I don't have that. And I don't have any interest in it. I don't think patients really care that much. I think as long as my place is clean, it looks clinical, they get in really good, nicely welcomed, they're getting their drinks, they're having a nice environment. I think that's what's really going to what thing they care about, not like a big fancy clinic that's costing me thousands in rent. And so, but that is just me. And I think it's just that making sure I do prioritize that work-life
I think
balance.
that's really nice. It's really nice to see that side of it, that you don't have to have that, big shiny 5-room clinic to be successful, and to have a really profitable clinic and a successful clinic. And on the topic of work-life balance, how do you manage to balance business growth with maintaining that work-life balance? What kind of things do you put in place?
So I've always said to myself, and I have broken this rule recently, I think this year has gone a bit mental for me, but I always said I would only want to do 4 days a week and then have a day admin, because we all know that, look, there's so much admin to do. And I do have a PA that helps me, but there's a lot of stuff I need to do, which takes a day. I think at the moment this year, I've tried to, I think I've joined a couple of faculties, and I've just started saying yes to quite a few things, which means then I'm going to conferences and talking more, which is great for personal growth, but it has meant I've sacrificed my work-life balance a little bit, and I had a bit of burnout because I've agreed to say yes to a lot of things. So my plan is now I'm going to prioritize not saying yes to everything and feeling like I'm, for example, rushing up and down the country twice a month to different events, and just focus on, if I'm going to do something, do it once a month. If I'm going to London, I'm going to do that once a month. And I also refuse to work more than one Saturday a month. So I only do one Saturday because I think the weekends are really important. Like, my fiance doesn't work on a weekend. I can do things on weekends with him. I can see my friends. I think for me, working on weekends is probably the one thing I've always said I will not do, apart from one Saturday, because I do appreciate people would want to come on a weekend, but also finding time to do things like go to the gym, like prioritizing. I mean, I'm getting married in July, so I'm literally having to like find time to fit in gym workouts along with
Yeah.
working, which is actually very hard.
Yeah.
But it helps with your mental health and your well-being and feeling like when you eat better, when you work out, you feel much better.
Mhm.
You're better with other people. You're better with your patients. So I'd be lying if I said I've followed this to the T the last few months, because it has. I think I don't know if it has been since the clean Rooney thing, but it has all gone a bit crazy in the last kind of 4 months. But it's now settling out a little bit, and I can look at my diary going ahead, and I've prioritized a few more things of what I'm going to say yes to and what I'm going to say no
Yeah.
to. And well-being is definitely going to be one of those things I'm going to prioritize more.
Yeah, no, so that's so important, isn't it? And I think it's very easy to want to say yes to everything and to feel like you're
Yeah.
missing out on opportunities or you're going to get left behind if you say no. But it is so important to have that balance. At the end of the day, there's only so much time that you have, and it's working out where that's kind of best placed. And, ultimately, you're growing a business, and so your time kind of needs to be invested mainly there with your patients. What's one thing that you regret investing in, and what's one investment that's completely kind of paid off? We've probably actually covered that.
Do you know what? I think what I'd probably say is when I say investment, I would probably say, I mean, obviously, despite the website scenario, but I think when I did training,
Mm.
I wish I had booked training that was more comprehensive. I think when you start, you want to jump on courses that they seem to cover about a million things in one day, because you feel like you're getting good value for money. And I remember coming away from a course that I did where it was like cheeks and advanced Botox, and there was so much to learn. And it was very much, I got one injection point on the cheek and I was ticked off to pass. And I remember dreading doing cheeks. I just was given a standardized pattern, and they were like, double it if you want more volume. And I made my friend's mom look incredibly gaunt, and I was like horrified. And I was so nervous about doing anyone's cheeks and adding any more volume. It put me off for months and months for doing anyone. And I went through another 12 months of just trying to teach myself, because I felt like I was like, I've spent this money, I can't spend more money. And in the end, I just ended up paying to go somewhere else where it was a lot more bespoke, to have better training and understanding. And I wish I'd learned sooner that not just more isn't always better. It's sometimes consolidating what you know into more like individual trainings that you feel more confident, because lack of confidence is where people probably it's a pitfall of why people either mistakes happen or people don't carry on with doing aesthetics because the anxiety can get too much. One of the best investments I made was actually when I mean, I don't think he does it anymore, but Lee Walker's mentorship course completely transformed how I looked at aesthetics, taught aesthetics, understood the anatomy. It was a 6-month program, and I was very fortunate to do it when he was still doing it. But that completely just made things click in my mind, and I realized the training I'd been on in the past was just substandard, and my growth from that, because I understood things more, I could confidently suggest more treatments, put myself out there from an educational point of view. I really started to push my educational side there, and that was probably the turning point. And that one, I think that was like 4 years ago now, but that was a turning point I can think of, that I thought, wow, this is what I need to do, and I understand things now. So learning and training, it has been the best investment.
Yeah, yeah, amazing. And you've really defined your niche in aesthetics as well over the last few years. I mean, you touched on with the ad side of things, you did a video about non-surgical rhinoplasty because that's kind of an area that you want to niche in. I think you've also mentioned full face rejuvenations. How did you decide on this niche, and how would you say that's helped your business grow? Do you think niching's important?
Oh god, 100%, because you can't be a jack of all trades. I'll first touch on noses and then tell you why I decided to go for more full face. So noses is something I realized not many people were doing. And I followed Dr. Ayad Harb, who was down in Bicester for years. And I thought, wow, his work is incredible. If I'm going to train with him, I'm going to go to him, because I'd done a nose course before. Again, it was really substandard. It was just very basic. There wasn't much assessment skill. There wasn't much injection experience. And I thought, if I can hone in on doing well with noses, I think I can really push it in the area that I'm in because I didn't know anyone else doing it. So I went on his training and again, just really pushed and pushed doing noses, got loads of before and afters, and I was slowly and surely getting more referrals, which was amazing. But then I thought, I was like, well, how, I mean, noses can make such a huge impact, but I always thought, if I want to make a really successful business, I've got to target more people because noses is a very niche skill. And not everyone, people come in for noses sometimes have not, wouldn't consider filler anywhere else. So one of the biggest things I think, obviously, and I know a lot of people say this, that full face rejuvenation makes the biggest difference, but it really does. And it isn't just about filling with filler. It's about the whole holistic approach from aging from all layers, from skin to bone. So I thought, how am I going to get into this? And my social media girl at the time, we decided to do a content day. So I got loads, about 5 or 6 models in, and we took all the videos of the injection techniques, the educational of what I was assessing, why I was treating where, how aging occurs, testimonials from each patient. And I really pushed because, again, I really love the visual videos where you see people in. I mean, I know a lot of people may not like seeing needles, but I loved seeing needles and the before and after transitions. And there was a woman I followed in America, and I said, I really love her style of videos. Can we make something similar? And from that content day, I must have got content that we could have repurposed for about 18 months, if not still now. And that was the turning point again, because I pushed myself saying, I specialize in full face transformations. And from then, I got so many more people inquire because I think it's really hard. There's not a lot of people that will agree to have their face on, Instagram or Facebook because, people are more private, which I completely understand. But if I was doing a content day and people are aware they have to have their photos and videos shared, to get that amount of people was amazing because not many people can get that. Because, like you said, if you're running a busy clinic, you don't always have the availability to ask people, or people, when you're rushed, like now, I can't show as many before and after because I forget to ask people because I'm just busier. Whereas back then I had more time and I really pushed the content days. And I always stress to people now, if you get a content day in, you can get so much purpose out of it that you can reuse. And since then, I've just been really fortunate. I mean, hopefully it's because I am putting myself out there, but I really talk about full face cases, why we age, and I really try and push myself. I'm not calling myself an expert in any way, but patients, I hope they will hopefully perceive me as someone of more of an expertise in this area because that is what I try and push. And the more you show a certain aspect, the more you will get in that as well. So
So true. And I think a lot of people are scared of niching down because they feel like it's going to put other people off them, which is so not the case. And I think niching down can be so powerful and help you stand out from other people in your area as well who might offer similar services in general. But if you're talking about how you're a specialist in this one area, or this is one area you're really passionate about, that's naturally going to draw more of those people who are considering that type of treatment to you. What advice would you give to practitioners who currently feel like they have to offer everything to everyone instead of kind of specializing in a specific area if they're worried about it limiting them in the types of people they might attract?
I think if you've got something that you really enjoy, whether it could be noses, it could be some people love just doing lips, or it could be cheeks. I would just say, look, if you really enjoy a certain aspect and don't enjoy doing something else, focus on what you enjoy because generally that will emanate and it will show in your content that you really enjoy it. And you'll also mean you're getting more of the work you enjoy. And instead of being, like I said, if you try and be a jack of all trades, like the best at lips, best at noses, best at faces, best at skin, it's difficult because you dilute down what you can offer, and I think if you just did a month of posts purely targeted to one area, I think the difference you'll get in actually people coming in. I tried this with polynucleotides actually. We did a month where we did just literally posts on polynucleotides, and the influx of people coming in because they were seeing more visibility of what I was doing was crazy. And I was like, it works, it really, really does. And things like I will notice, if with my training, if I haven't posted in training for ages, I don't get any inquiries. As soon as I start posting more, people inquire more. So you need to show what you want to push, you need to be more visible in that particular area, but really focus and get good on one thing. Because if you get good at smashing one thing, you get more word of mouth. People will refer that more people to you, and you, like I said, you want to be known as the specialist in an area. because that's, you're going to get way more people, the right people coming to you.
Yeah, absolutely. So you've had an amazing career so far and you've learned a lot along the way. If you could go back and give yourself one piece of advice when you were first starting out, what would it be?
I would probably say if I could do it again, I would have invested in better training. I wouldn't have gone on training where everything was covered in one day. I would have invested in better training, saved up, put things on a credit card, and just saved up and gone on training that was more thorough. Because I think I would have spent less. I would have been able to progress faster in my career
Mm.
had I not been held back from the anxiety and the nerves of the outcomes with Botox or fillers. So I think it would just sped things up.
Yeah. Brilliant advice. Yeah, very, very great advice. Oh, it's been so lovely speaking to you. You've given so many amazing insights into, your career and how you've got to where you are today and what's worked for you. And I've loved hearing about your journey. Very, very inspiring. I'm sure it's going to be very valuable to a lot of people listening. So thank you so much for coming on, Amy.
Oh, thank you so much for having me on, Emily.